Coming up on the Get Lean, Eat Clean podcast.
For a middle-aged male, total testosterone, you would expect optimal to be between about 500 and 1100. Free testosterone, uh, between about 12 and 29 nanograms per deciliter. Picograms per mil is sometimes also used, which is a factor of 10 different. And then for estradiol, as high as possible without symptoms. But in general, a ratio of about 3-to-1 estradiol to free T. For example, if your free T is 20, your estradiol could be 40 to 60, which is about 2 to 3 times higher.
Hello, and welcome to the Get Lean, Eat Clean podcast. I'm Brian Grin, and I'm here to give you actionable tips to get your body back to what it once was 5, 10, even 15 years ago. Each week, I'll give you an in-depth interview with a health expert from around the world to cut through the fluff and get you long-term sustainable results. This week, I interviewed Dr. Kyle Gillett, a dual board certified physician in family medicine and obesity medicine, and an expert in optimizing hormone levels to improve overall health. We discussed Dr. Kyle's 6 pillars of health, along with are calories important to track, will zone 2 cardio improve mitochondrial health, important blood panels to test, Dr. Kyle's favorite supplements, and his one tip to get your body back to what it once was. Really enjoyed my interview with Dr. Kyle. I know you will too. Thanks so much for listening and enjoy the show. All right, welcome to the Get Lean, Eat Clean podcast. My name is Brian Grin, and I have Dr. Kyle Gillett. Welcome to the show.
Thank you for having me, Brian. A pleasure.
Thanks for coming on all the way from Kansas. And you have a practice there as well, correct?
Yeah, I have what I call a health optimization clinic. It offers direct primary care for locals, individualized medicine, which is basically just the whole conglomeration of evidence-based medicine, whether your needs are functional or hormonal or fertility or aesthetics or whatnot, and then a concierge practice as well. And we also do telemedicine.
Wow. That is great. Do you see this as like a growing trend in the medical community, what you're doing out there?
I don't think individualized medicine is necessarily a growing trend. There's a few healthcare clinics and a few physicians that do individualized regimens, but often that requires attention to mechanism of action. So not just knowing what to do according to the algorithm, but also knowing what to do given different situations and understand each person's physiology, get good objective data like labs and diagnostics, and then explain the benefits and detriments in layman's terms to each patient depending on their genetics and their situation. However, there is a huge trend of like med spas that dabble in hormones, or hormone clinics that dabble in functional medicine, or functional medicine clinics that dabble in hormones. But I consider those kind of different entities.
Yeah, I recently had on this gentleman, Dr. Michael DeYoung. He was urologist for 30 years and a surgeon. And a lot of his talk was how, the medical community, there's not a lot of training as far as nutrition and like preventative medicine is concerned. What type of, I know you're a board certified physician, but what type of other education did you sort of routes did you go down in order to, provide such a service?
Yeah, I'm board certified in obesity medicine, which does have a lot of training in nutrition, especially if you go to a reputable place like NIH in Columbia has a combined Institute of Nutrition, I believe.
Okay.
And they have some great CME programs. In addition, I'm also board certified in family medicine, and I chose a residency that really emphasizes food as medicine and exercise as medicine, which is inherently 2 of the fastest growing student interest groups in medical schools across the country. In general, I think the Midwest does a great job of emphasizing primary care in medical school. However, during residency education, and there's many reasons for this, I'm just kind of stating the problem, if you will. We have the least qualified and the lowest scoring medical students going into the most complicated broad spectrum specialties like family medicine and internal medicine. So that's the problem. Laid it out there. There's many things that can be done to help, but I am glad that many residencies are emphasizing food as medicine and exercise as medicine, for example.
Yeah. Yeah, that is definitely a growing need. And what would you say? I noticed you talk about like 6 pillars of health. Excuse me, interesting that you have that, because I work with individuals and I have sort of like my 6 pillars. I'm curious what yours are as far as when you start working with an individual.
Diet and exercise are the first two. And I just added a seventh one too.
Oh,
Ritual
okay.
convinced me to. Social health is the seventh one. But the
Oh,
last five are all S's due to alliteration, and they're easy to remember. Sleep, stress, social, spirit, and I believe there's one other one that I haven't said yet. Sunlight. So sunlight's like cold
sunlight. Yes.
exposure, hot exposure, being outdoors. Humans are not meant to be indoors. So we have not been primarily indoors for quite some time, and we have not had the same temperature control and electricity
Mhm.
for a long time. So, but anyway, I like to say that these interventions are more powerful than any medication or supplement, and they're like the first thing to look for when either treating a pathology or optimizing a specific marker of health, like athletic performance or cognitive performance.
Yeah. No, so we're right on the same wavelength here. And you added in social.
Yeah.
I like that, especially because just like with the whole pandemic, like everyone's just not used to being around other people and having like that social interaction. Is that the reason you sort of added that in?
That's one of the reasons. Another reason is as I walked into Rich Roll's podcast, I was traveling with my kids, and they are both toddlers, and both of my boys were just screaming and having fits.
Mm,
So a lot of times the health of the family unit can have profound implication on each individual's health. For example, it's well known in nicotine cessation that like in general, all nicotine out of the house, that helps, but everybody in the family attempting to quit at the same time is far more successful. And it's the same thing for any other thing that you're trying to achieve.
yeah, if it's done in a group atmosphere, there's a lot more. You're not a lot more apt to change.
Yes. What are your six, by the way?
Yeah, now you put me on the spot.
Sorry
uh,
if I put you on the
no,
spot, but
no. Yeah, no. Food, meals, obviously what you eat, when you eat. So that's all one. And then sleep, stress, creating clarity, and what else am I missing? See, I'm like you. You like have it in your head. Sleep, stress, mindful. Oh, like meditation as well.
mhm.
So,
Yep.
is that something you talk about as well with individuals? Is some type of mindfulness practice?
Yeah. I would consider that to mostly be under the spirit pillar of
Yeah.
health, but
Okay.
also the stress pillar of health kind of go hand in hand. Um, but whether it's mindfulness or whether it is meditation or prayer or different types of like subsets of yoga, I think all can be helpful tools. And it kind of gets at that interplay or the interconnectedness between because it's body, mind, and soul, between your mind and your soul. And your soul is kind of it is metaphysical.
Mm-hmm.
It's where you are on Maslow's hierarchy of needs, what you're looking at in that very top of the pyramid, which is self-actualization. And then that has very close interplay with how your fight or flight or rest and digest are balanced, or just your mental health well-being in general.
And do you believe that there are actually positive stressors that individuals can incorporate into their lives? I know you talk about like sunlight and cold exposure and warm therapy and things like that.
Absolutely. Stress is kind of like effort. If you learn how to enjoy the effort or enjoy the stress, then that is going to cause a positive feedback mechanism where it helps not only your like resilience, science, and mindset, like Dr. Crum often talks about, but also your hormonal health. So we know that there's definitely a bit of a positive feedback loop when it comes to, for example, testosterone production, where you achieve something that is very difficult, and then you have that not just dopamine, but also testosterone improvement soon after. Now, one instance is probably not going to make a huge difference, but cumulatively and consistently over time, it can.
Do you think that, I mean, I always talk about these stressors, right? Like fasting, calorie restriction, even carb restriction, these stressors. I've had like some individuals on my podcast recently, Jay Feldman, um, talking about more like this bioenergetic viewpoint. I don't know if you've heard of any of that with Dr. Ray Peat, who actually recently just passed away, but and they talk about that, for example, like carb restriction, these are stressors. They cause these counter-regulatory hormones to increase and could cause issues with thyroid and things like that. What are your thoughts around that as far as hormonal health with all these stressors?
So I suppose the dose makes the poison with a lot of stressors, especially when it comes to diet. Some things like trans fat and margarine potentially can be a lower dose. Some things require a much higher dose. For example, for one of the 10% or so of metabolically healthy individuals in the United States, even something like a drink with a whole bunch of sugar in it, like refined sugar, is not necessarily a stressor. So, and I think your approach is very similar to that as well. It's unique. Some people just literally have a genetic polymorphism to where they tolerate carbohydrates better without developing insulin resistance. So,
Yeah.
so I don't want to just answer that. It depends, because everything
Right.
depends. But yes, stressors definitely make a big difference in hormone health. One of the most well-known, I guess, widely applicable strategies is when you look at individuals in a significant caloric deficit. So, not just 50 calories a day. The group that goes on a very low fat diet does have significant decreases in sex hormones, for example, testosterone. So finding healthy fats, especially when you are in a significant diet, is of importance for maintaining good hormone health and good lean body mass, and then good metabolism and less chance of rebound.
Got it. And regarding calories, so it's always a hot topic talked about. And what are your thoughts around calories in, calories out, as far as that's role with diet and maintaining weight, and also, well, I got something to piggyback off that, but go ahead and you can answer that. Yeah. Yeah.
Yeah, for sure. I love talking about calories in, calories out. Obviously, you're not going to break the laws of thermodynamics. Calories and calorie tracking is one of my favorite tools, one of them, but it is not the only tool. So the problem with that is when you respond to any actionable item or any tool to help with body composition, maintenance, or changes with no, calories in, calories out matters more, then it downplays the importance of other factors. For example, on my nutrition prescriptions, there's like 6 or 7 different things that I like to circle, and then ones I add in sometimes. For example, number of meals per day, or eating speed, or number of plates per each meal. For example, take what you normally would put on one plate, put it on 3 different plates, eat one plate, wait 5 minutes, eat a second plate, wait 10 minutes, and then eat a third plate if you're still not satiated. Macronutrients is another one that can be added in from time to time. Slow bites can be added in from time to time, using different tools to eat, like chopsticks to eat a lot of different things.
Well, that would take me a long time to eat.
Yeah,
I'm
and
not so good with
sometimes
that.
yeah,
Yeah.
and sometimes that can be therapeutic as well. But anyway, there's a different tool for each situation. For people that are stuck in quicksand, there are different types of quicksand. They need different tools. And we also need different unique tools depending on our situation.
That's interesting. The different techniques you talked about with putting it on different plates, using chopsticks. I'm a big golfer. It just made me think about how there's many ways to learn one thing, right? And that's interesting. You could tell someone to eat slow, but what does that mean? Like, what they might not do. They're looking. They need something almost in their way to make them eat. So same thing with golf, but we won't get into that right now. Interesting. So, how do you get a good measure? Because my only, obviously calories do matter. I'm not like totally against that. I don't. A lot of times, like with calorie counting, how do you constitute that as far as the accuracy of it, and then even if they're absorbing everything that they're taking in, as well as like calories out, like it just seems like it's a bit ambiguous. There's a lot of ambiguity around that. And so how do you go about creating accuracy for that?
You could be as scientific or I guess you can be as quantitative or qualitative as you like. Most people who track calories, it is a very qualitative thing. They are not in as much of a deficit. For example, physicians and dietitians, when they're asked to track calories burned and consumed, they overestimate the amount of calories burned by at least 10% and underestimate the amount of calories consumed by at least 10%. And then for your layman, it is going to be significantly higher numbers than that. So that being said, you can qualitatively still use that tool.
Right.
Or you can quantitatively use that tool. You can track your RMR and you can measure it, usually at places where you get DEXA scans. And then you can like buy food services. There's a whole bunch of ways. Most of the time, patients have already tried calorie counting. And one of the biggest pearls that I have found is that if that's the first thing you go to, and there is someone who, usually by the time they found a board certified obesity medicine physician, they've seen a few other professionals and tried it on their own. And if their like heart is set that calorie counting does not work for me, then you don't destroy your rapport and then lecture them about how calories in equals calories out. You might find a tool like tracking macronutrients, which you can estimate their calories from the macronutrients. So maybe they would have better success utilizing that and other tools.
Yeah, I mean, I've tracked my own calories here and there, and I find that, like, at least for myself, I don't know about you, Kyle, it's like you eat the same stuff week in, week out for the most part. So once you do it for a week or two, you have an idea of how much you're consuming on average per day.
Mm-hmm.
What are your thoughts around like macronutrients? Do you someone comes to you and they obviously want to lose weight, and most people want to lose it really fast, even though it's taken them decades to maybe put on this weight. Do you take a certain approach as far as macronutrients is concerned?
Usually my approach of macros is ensuring that they have enough high quality protein sources. Just like carbs, fats and proteins are not created equal. I have done deep dives in the Gillett Health Clinic podcast into like each of these, because there's a lot of medications. For example, omega-3 ethyl esters, it's a type of fat. But regarding protein, you want to make sure that you have, in general, about 0.8, and depending on the individual, it can be, of course, be slightly higher and lower, 0.8 grams of protein per pound of body weight per day.
I'm sorry to interrupt you. Do you say per pound of body weight or desired body weight?
I usually say per pound of body weight. For desired body weight, it could probably be less than that in general. Usually I just put the caveat in there that depending on the person, it can be slightly more or slightly less. So for someone that weighs 400 pounds, that is over 50% body fat, then that can obviously does not have to be over 300 grams of protein per day.
Okay. Gotcha. Yep. Sorry to interrupt. I just wanted to get that.
Yeah, no, it's a good clarification. That's actually a pretty good idea as well.
And then, so you got protein, obviously. I always talk, we talk about prioritizing protein. And then from there, as far as obviously fats, where do you go? Is that a lot of times just maybe cooking in the right type of fats, things like that?
Yeah, using the right types of fats to cook, perhaps chatting with the dietitian about smoke points, especially if like knowledge regarding fats and how they can change is not great. And then also thinking about fats that you may not be aware that you're adding. And in addition, I love to talk about alcohol, 7 calories per gram. So pretty high caloric density macronutrient there, and liquid calories in general. Whether it's fat or alcohol or carbs. I love to talk about liquid calories. And then fiber, because a lot of fibers actually have calories as well. For example, like allulose versus isos. They don't have, they're carbs, so they don't like have 0.5 calories per gram, but you might absorb 1/8 of them. So they're like, per gram, how many calories are you needing to burn is often lower. So thinking about a lot of those other additions is something that can be clinically significant.
And just going back on your point regarding, because I do DEXA scans with my clients along with myself, we have a lot quite in the area, but I just got one done recently. Did you mention that it gives you your BMR or your
a lot of places like DEXA Fit, you'll be able to, they have like a couple different offerings, and usually try to upsell you a package where you get your BMR and your VO2 max and et cetera, et cetera.
Got it.
Yep.
Is that something you use with clients? Do you have them do DEXAs? Because that's something I've been trying to do for most of my clients.
DEXA is my favorite thing to test of the three. VO2 max isn't terrible, but usually I do not have them do metabolic rates, basal metabolic rates. DEXA is a couple other things, couple other clinical pearls, if you will. Yes, if you change the amount of carbs you're consuming, you'll have to think about glycogen depletion and repletion and how that shifts water and water weight, which is detected as lean body mass. Same thing for creatine. But in general, if your diet hasn't drastically changed, DEXAs are pretty good longitudinally over time.
Okay, so there could be a few downfalls with DEXA, meaning it might detect what'd you say, lean mass when it's really just water. Is that what you were saying?
Yeah.
Okay. Yeah, because I just did one. I'm doing this little self-experimentation where I've added in an extra meal, because I used to just do a couple meals a day and do a little bit more fasting. And I was like, thyroid was maybe a little bit lower than I thought. So I been implementing carbs more into my diet. And yeah, I'm going to be doing a podcast on it soon, but definitely went up in body fat percentage, but I mainly whole food carbs like fruit and things like that. Do you have ways to target and use fruit as something? Because you see this coming with some of the carnivore craze, with everyone that's been so low carb for so long, and perhaps maybe it's taken a hit on their hormonal health. Do you see adding back things like fruit as beneficial?
Eating healthy carbs can certainly help increase free testosterone and decrease SHBG, which is the protein that binds up androgens and estrogens. So it can be helpful. As most people are aware, not all fruits are created equal, and chopped up fruit is not equal to whole fruit.
But don't chop it up.
Yep.
What about food combining? Do you have any thoughts on that?
I don't think I'm familiar with what food combining is. What's that concept?
Sometimes people will say, oh, you should eat a certain food by itself, sometimes mixing like fruit with other things, or
yes.
So
yep, no, definitely significant, especially when it comes to artificially or low or no calorie sweeteners. Okay. So there's been decent studies done, and there will be a lot more, because that's another super hot topic.
The sweeteners.
Yeah, consuming like liquid or just artificial sweeteners in general, or natural sweeteners, can like potentiate the glycemic response of a meal. And not all high glycosylated end product foods, which is basically foods that are known to increase things like glycosylated albumin, A1C, markers of diabetes, essentially. Not all of those are elevated just due to carbs. So,
right.
Yeah, I guess I do think that that's a fairly important concept, but not as much. I'm not sure what the premise of it is. If it's like eating fruit and meat separate, I wouldn't think so.
And then as far as sweeteners, obviously you see like stevia is in like everything,
Yeah.
Which I guess has been, I don't know, what are the studies around that, and which sweeteners maybe people should avoid?
Yeah. A good concept to think about when it comes to artificial sweeteners is there is an opportunity cost for not utilizing an artificial sweetener. And that's, you are much more likely to seek out, especially if you intuitively eat, don't track your calories, you're much more likely to seek out other sources of sugar, which have many more calories. So there's actually a lot of A ton of things are potential carcinogens, but are not clinically significant carcinogens. And the artificial sweeteners that are allowed for use, for example, sugar alcohol, erythritol, aspartame, stevia, xylitol, in reasonable quantities, in my opinion, none of them are concerning carcinogens, especially when compared to, like an equitable dose of just consuming glucose. Developing that insulin resistance and metabolic syndrome is definitely a higher cancer or neoplasm risk. Yeah, sorry if that question rabbit trailed a bit, but in general, I am not anti-artificial sweetener. I consume some artificial sweeteners myself. It is interesting that stevia has become so prevalent. I try to consume everything in moderation and try to consume as few as possible. For people that have a lot of a sweet tooth or they're driven to seek out sweets, they might need to watch it more closely just to keep in moderation.
And on that note, what is like your typical routine? I'm a big routine guy, morning, night, sleep routine. What type of routines do you implement into your day?
Yeah, I like to eat in the morning, and a lot of times I eat eggs. We have like pasture raised chickens out back.
Oh,
They
nice.
lay a lot of eggs, and I like that. In general, I like to have a protein shake combination of like whey, albumin, and casein in the morning. And after that, I exercise, not because it's best to exercise first thing in the day, just because that's when I can do it. And then
Is there a reason I'm sorry, you have eggs and you make a shake. Is there a reason you do a shake as opposed to eating foods?
convenience,
Okay,
only convenience.
got it.
Of note, I suppose, eating whole foods is nearly always better. I try not to consume any liquid calories at all. At one point, after I had my first son, I lost probably 40-ish pounds.
Mm.
Um, mostly body fat, but not all. Um, but at that time, I did very few interventions. I cut out all my liquid calories, with the exception of two adult beverages every 2 weeks. And then I had a casein protein shake, which can increase prolactin a bit, but it is good for satiety, along with a bit of oats. This was when I was in residency. So although I don't think time was any more short in residency compared to now.
Right.
But anyway, that's basically what worked for me. And I also consumed foods that I really loved a ton that are of high nutrient density, but low caloric density. So for me, that was spinach, Greek yogurt, and egg whites.
That's what you consuming now or what you used to consume?
I used to consume a lot of those. From time to time, I still do now. But when I was attempting to be in a caloric deficit and have weight loss, I enjoyed consuming those. And they made me feel like I was not hungry, which I liked.
Got it. So high nutrient dense foods. So what else? So you'll work out after mid morning, let's just say, then you probably go to your practice.
Yep.
And then what about evening routine? Anything around there? I know you have two. How old are your kids?
One just turned 3 and one is 17 months.
Oh,
And we try to eat dinner at the dinner as a family. We decide what you're eating and when you're eating, and they decide how much and when they're done. And that seems to work pretty well. Then after that, we usually just play around, play little tykes basketball, maybe wrestle, and then it's bedtime. And then, so yeah, absolute pandemonium during bedtime. After that, I can relax a little bit, catch up on work that I haven't done from earlier that day, perhaps, talk to the wife. And I tried not to eat after bedtime, but sometimes it can be hard.
and outstanding. Okay, I like to know people's routines. It's fun.
Yeah, it's not a perfect routine, but it's what I have gotten used to, and it it works well enough when I'm in a maintenance phase like this.
Yeah, I hear you. And going back to your pillars of health, obviously sleep and stress, and then you got social. We talked about, sunlight. I'm a big fan of walking. I have two dogs, so we average like 3 walks a day. no matter the weather. What do you emphasize for clients around sunlight? And you even mentioned some cold. I actually have a cold plunge. I put one in. I've had it for like a year. It's like unbelievable. It's great. But anyways, thoughts around sunlight, walking, some stressors that you like to recommend.
Extremely helpful. I do try to get my morning sunlight, a la Andrew Huberman,
Mhm.
and I do try to get my evening sunlight as well. We have two wolfhounds, so we're taking them on walks very often, usually after dinner, and then on the weekends after breakfast, lunch, and dinner. And then noon hour at the office, myself and as many staff as possible do like to go out when the sun is very strong and take like a 15 to 20-minute walk. So I think that helps us power through the afternoon well.
Yeah, I always say walking is one of those just like biohacks that is simple, should be fairly easy for most people. Is this something that you try to get your clients to do maybe right off the bat?
Yep, absolutely. When I was in residency, we had something called Walk with a Doc, where patients could just literally show up at this nice central park location
Oh,
and we'd all just walk because it's one of the best things that you can get in a good habit of doing. Um, but yeah, walking is not the only exercise people should do. There should be a combination of resistance training and uh, basically cardio. And you do have to walk pretty fast, really fast in order to get into zone two. Not everybody's able to do it.
and I was actually just going to touch on that zone two. This is coming up. Obviously, Dr. Peter Thiel has talked a lot about it. Maybe explain to people a little bit about that if that's something that they want to implement.
Yeah. Zone two is relatively easy cardio. You're not killing yourself. You're usually able to do it for a very long period of time. You can look at your heart rate and calculate based on like your maximum heart rate and where you are for the other zones, what your zone two would be. For most people, it's, around 110 to 135, 40. But it depends on the person. A good rule of thumb, and you don't necessarily have to track your heart rate the entire time you do zone two, looking
No.
at your fitness tracker to see if you're still in. You can, but a brisk, somewhat difficult pace, but you can still talk through it is a good rule of thumb.
And what is all? I guess maybe a couple of reasons why zone two is beneficial.
It's particularly good for mitochondrial health. Zone two, and then also REM sleep. That's going to prevent, that's like the number one and number two things to prevent mitochondrial damage. You can take a full stack of mitochondrial health supplements, and they're still not going to benefit as much as just the zone two and the REM sleep.
And regarding REM sleep, because obviously sleep is a big one. What do you use any supplementation for individuals that maybe need help with sleep, or do you more or less so look at maybe like their sleep routine and ways to maximize their sleep quality with that?
Yeah, just like any other health optimization parameter, often both the medications and supplements are just tools, whereas the lifestyle interventions are the actual work or digging or whatnot. I do like the 10-3-2-1-0 rule. Within 10 hours or so, no caffeine, or if you know your genetic polymorphism of how fast you metabolize it, you can go sooner or later than that. But in
Mm-hmm.
general, nobody should be consuming caffeine within 10 hours just because of adenosine signaling. And then 3 hours would be I believe it's no exercise, no vigorous exercise within 3 hours, or no food within 3 hours. 2 hours, um, ideally no food at all. And then 1 hour, no bright white or blue lights, and ideally no screens, and then zero snooze in the morning.
Oh, how come no snoozing? You should just get right up, right?
Yep. It's kind of like uh, I forget if it's called Pavlov's dog, but it gets you in the habit of um, alarm goes off if you need to wake up to an alarm. You are up. Also, your circadian clock will. A lot of people do this, and when I get up at the same time, I do this as well. You wake up like 5 minutes before your alarm, 10 minutes before your alarm.
Yeah.
That's not a coincidence. That's usually because you don't snooze as much.
Okay. Yeah. You know what? I usually tell myself I sometimes I set an alarm, but usually I'd be like, you know what? I want to get up at this time, and I get up. Is that like is that a good sign? I don't know. I tell myself when I want to get up, and I get up usually at that time.
Definitely a good sign.
Okay, good. Unless like now you're in Kansas, I'm in Chicago. It is dark. I mean, we haven't had sun in like I think this is the ninth straight day without sun. Um,
Yeah,
so
it's been pretty dark here.
okay. Anyways, so zone two cardio. Okay, and then what thoughts around like I just did a big blood panel. Actually, I just got blood work done. I'm waiting back on the results, but I usually do that I do that in combination with the DEXA. Um, certain blood work parameters that people should look at. I know that obviously you talk a lot about hormonal health. What things should people maybe be at the forefront of their mind for blood work?
Fasting insulin, A1C. There's no reason why everybody shouldn't be getting an A1C. And then SHBG, which is that protein sex hormone binding globulin that binds up all your other hormones. Definitely a CBC, CMP, lipids, which are pretty routine. If your lipids are high, especially an LDL over about 130, then get an ApoB, which is apolipoprotein B. It's a better marker to track for risk of heart attack and stroke, what we call ASCVD. In addition, as far as hormones, you definitely want to get a TSH. And if you were at risk or have hypothyroidism, you want to get free thyroid hormones and possibly even more. And you also want to get a CRP, which is a marker of inflammation, also conveys cardiovascular risk. A lot of people should also get a homocysteine, which is another inflammatory marker, but it also has to do with like how well you are utilizing your B12 and folate, how well your methyl donation is, and how much inflammation you have in your body. I think of it as oxidative stress. And then testosterone, estradiol, which is your main estrogen, and progesterone for most people. And then IGF-1, which is a decent marker of growth hormone. Just those labs, that's basically what I call my essential panel. But a lot of other people, a lot of other, I guess, businesses that sell labs direct to consumer, they call it like a comprehensive panel. But for me, that's just the essential panel.
Right. And gosh, I was going to ask you regarding hormonal health. Are there certain levels? I mean, you talk about testosterone and even DHEA and thyroid. Are there certain levels that you look for with, let's just say, middle-aged men?
Yeah. For a middle-aged male, total testosterone, you would expect optimal to be between about 500 and 1100. Free testosterone, between about 12 and 29 nanograms per deciliter. Picograms per mil is sometimes also used, which is a factor of 10 different. And then for estradiol, as high as possible without symptoms. But in general, a ratio of about 3-to-1 estradiol to free T. For example, if your free T is 20, your estradiol could be 40 to 60, which is about 2 to 3 times higher.
And explain estradiol just for the listeners.
Estradiol is the strongest estrogen. You also have estriol and estrone, but estradiol is by far the strongest. It binds to many receptors, but estrogen has a whole bunch of receptors, 7 or more. But some of the most important ones are estradiol alpha and estradiol beta. Depending on the ratio of those two receptors that you were born with or inherited in your prostate, that has a huge implication for prostate cancer risk. In fact, a lot of things that block specific estradiol receptors can be used for both breast cancer and theoretically prostate cancer as well. Then it also has to do with how fast your growth plates in your bones will close. So estradiol closes growth plates, but it also accelerates growth. It helps with something called type 3 collagen synthesis, which is the collagen that's in keloids that helps with like elasticity of the skin or very fast scar formation. So if your wounds are healing slow, then you might have too low of estradiol. And then last and most importantly, estradiol helps with normal lipid metabolism and platelet formation. So if you have deficient estradiol, we know that those individuals are certainly at risk of heart attacks and strokes because of it.
And you said estradiol pretty much as high as you can get it without
symptoms.
Okay.
And probably not higher than about 3-to-1 estradiol to free T ratio. And that's for people with a normal SHBG.
Got it. And I know you talked a little bit before about gene, like, do you look at gene SNPs and certain ones for, for example, like I've done the 23andMe and taken a look and put it, I believe Dr. Rhonda Patrick has some, just software you put,
Promethease.
what's that? Yeah.
It's called Promethease.
Okay. Where it sort of takes um, your gene SNPs and sort of parses them out. And one of them, and I forgot the name of it, and maybe you could remember for me, but the one where you don't, I guess, absorb or digest saturated fats as well.
Mm-hmm.
Is this something, do you have most of your clients do some people might not be for it, so they might not want to do it, but like, do you have them do some type of gene testing?
Yeah, occasionally I'll look at things like that. If you look at lipid metabolism, it can tell you some clinically significant things for pharmacotherapy, like if you're a good candidate for ezetimibe, also known as Zetia, or not, which affects lipid metabolism. There's also useful SNPs, for example, factor V Leiden, which conveys VTE or venous thromboembolism risk, blood clot. However, a lot of those services, one, they might not be 100% accurate. Usually they're like 99.9 or 99.8. So confirming with your doctor is always important. Also, whenever you order a genetic test, there's something called the sick roll, which is basically you get a test and you find out you have something that's not optimal, and then you feel less healthy because of it.
Right.
So that's also a very important consideration. And then also, most tests like 23andMe are 0.01 or 0.02% of the genome. So a SNP is like one letter of one word of one sentence of one paragraph of one chapter of one book of the Encyclopedia Britannica, except a much larger scale than that, where you can have different mutations, like a frame shift. So instead of just one word, they scramble the words. Or you can have a deletion, you just delete a word. Or you can have a repeat where you have CAG, 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 like in Huntington's disease, Fragile X, or the androgen receptor. So all of these are very common, and you would need full genome or at least full exome sequencing to evaluate those. And occasionally we do test for those as they are clinically significant.
Okay. So sometimes you'll bring it in, but not with everyone.
Not necessarily with everyone.
Yeah.
For concierge patients, if they just want to look at stuff, I think that is also reasonable after a shared decision-making process. But I also think that for example, nutrigenomics, I think we are a long way from being able to use that in a clinically significant way, especially with every individual. Dr. Michael Snyder of Stanford, I think, is a good source of evidence-based information regarding like nutrigenomics and whatnot.
Mm-hmm.
Yeah, I kind of see precision genomics just like any other test. My colleague, Dr. Taylor Martin, who's a board-certified preventive medicine physician trained at Johns Hopkins, and he would say very similar.
Got it. And let's touch a little bit about some of your. I've seen some of your posts regarding supplements. You've done some breakdowns. Maybe what are some of your favorite supplements? I know there might be a decent amount of them that you currently recommend.
Yeah. I love talking about supplements. My favorite supplements personally might be slightly different, but relatively the same. Personally, my favorite supplements are creatine. Hard to beat creatine, even if it's just for mitochondrial health in the brain, energy in general, decreasing homocysteine.
Do you normally with your creatine, you normally just put it in your shake?
Yep.
Okay.
I don't mind the taste. My wife does not like the taste of creatine. I can't even taste it.
I can't even tell it's in there, so I don't know.
Yeah. Maybe it's something like stevia or licorice or TPS paper, where it's just like a genetically predispositioned taste or no taste. If people, if our science majors remember licking that paper in college,
Yeah.
maybe it's like that. I don't know.
Well,
But yeah. Anyway, I take 7 grams a day.
7. Okay.
I just throw it in with a shake. I guess we could mention protein powder. Personally, I like taking more animal-based proteins or high leucine content, high methionine content protein powders in the morning. That way I kind of have a slightly better balance toward catabolism. I'm not a fan of casein shakes in the evening. They're going to activate mTOR a lot. I try to digest plant, or if I take a protein shake in the evening or afternoon, I do plant protein, and I try not to have too much plant protein, or sorry, not too much animal protein. That's like
Regarding,
added
yeah,
unnecessary.
sorry to interrupt you there, but regarding casein, because you've seen that where they're like, oh, you should take it towards the evening because it's slower digesting, but you don't like that.
Nope. For like a growing child or a pediatric patient, if that's something that benefits them, that's a consideration. But for adults, I would think that is the opposite of what you want. So some people are familiar with rapamycin, and like Dr. David Sinclair and Dr. Peter Attia used to talk about that. Think of casein protein as the opposite of that. So protein quality matters. You're usually looking at like methionine content, leucine content, and those tend to be very high in most animal and dairy proteins, like casein.
So are you against casein, or you're just against it in the evening?
Just against it in the evening.
Okay.
You can also, like, this is for sure applicable to fasting windows as well. So if you want to get into the like beneficial window faster, then you can skew your proteins to more plant-based as you're approaching the fasting window.
Is that because it doesn't? What's the reason behind that?
There's several mechanisms. One, it's going to boost up growth factors less, but a lot of it, and mTOR is not the only marker that matters. It has an mTOR PI3K AKT pathway, and that is definitely one of the like beneficial cell checkpoints. For example, if you have a mutation in mTOR, it's an oncogene, which is related to cancer risk. But between that and other growth factor activation, then you're going to have a faster onset or slower onset depending on what protein source you consume the meal right before your fast.
Got
So
it.
I guess if you're like OMAD or something, it doesn't really matter.
Okay. So if you're saying if you lean towards plant-based proteins towards a fast, that's beneficial in the sense that it doesn't stimulate some of the like the mTOR and things like that you know so you'll help you get you into the fast quicker. That's what you're
It
saying.
would kind of mimic the effect of, for example, taking a rapamycin in the evening every 1 to 2 weeks, or mimic the effect of taking a metformin 2 or 3 times a week in the evening.
Okay.
Yep. There's a lot of strategies. Another interesting one is taking quercetin. So it has to do with both the rate of growth and the atypia of the cell growth and division. So you want both to be relatively low. For 90, probably 98% of people, how you can help this the best is just the lifestyle pillars: diet, exercise, and not developing metabolic syndrome and not developing insulin resistance. That being said, I like to, especially for someone who's like, has all those dialed in and is concurrently at very high risk of cancer, it is interesting to think about ways that they can decrease their cancer risk somewhat naturally.
Okay. So far we got creatine.
Yep.
We got protein, and depending on the type when you're taking it, you typically like to use whey in the morning. It sounds like, or you combined it maybe perhaps with casein,
Yep.
and then quercetin, right? What else we got going?
I also like vitamin D and omegas. So each person's going to benefit by an EPA to DHA ratio that's different. I like doing omega checks and just objectively seeing like how much omega fatty acid is intracellular and kind of titrating according to that. Omegas are not without risk. For example, very high doses even conveys an AFib risk. And then vitamin D, most people, especially this time of year, are going to be suboptimal. I like that to be between about 40 and 100.
Now, if someone is not, because like for example, I'm not suboptimal as far as vitamin D is, but like I just said, we've just gone 9 days without the sun. Do you think that it's worth even supplementing during the winter, especially if you're in the Midwest?
Yeah, it definitely is. I supplement all through the winter. I also have a touch of what I'd call seasonal affective disorder, where I just literally feel slightly better when there's brighter sunlight and longer days.
You and everyone
And
else.
yeah, my regimen for that is vitamin D and the full spectrum light that is on like our hydroponic system. So,
Oh, like an infrared sauna, go ahead.
I'm not sure if it's infrared, but it's just considered like a full spectrum hydroponic light. I believe it's like the same full broad spectrum of wavelength that's on I think they call it a daytime light.
Okay.
Yep. I don't have an infrared sauna or a regular sauna yet. But at some point
You gotta join me. I'm lucky I put a plunge in a sauna.
Yeah.
Yeah.
Very jealous of that. That's awesome.
Yeah, yeah. I tell my wife, I'm like, she doesn't use them really. I'm like, do you know how many people would love to have infrared and a plunge in their house? But anyways,
Yep.
lucky to have that. Okay, so creatine, protein, and protein powders. There are like a million on the market, and we don't have to get all into protein. But what type of protein? Like I know not whey or casein, or is there like specific? Maybe even if there's a brand that you like that people can look into. I've tried different types as well.
Yeah, I switch between brands really often. I used to get My Protein because you could get an 11-pound bag, and I saw an analytical chemist post somewhere. They evaluated it, and the My Protein like protein quality was decent. You get 11 pounds for $50, but I don't think that's possible anymore. Um, the most recent one I tried is on the Black Friday sale at Gorilla Mind. I bought one of their peanut butter proteins. I think it's good if you can consume peanut butter products. Way back in the day, I thought the best protein ever was Muscle Farm Combat Protein. It tasted like cookies and cream. And I did not read ingredients back then, so I'm not sure if it's good or
Right.
not, but I can confirm to me it tasted great. And it had albumin, micellar casein, and then isolate and hydrolysate whey. So kind of like your full spectrum of digestion times for animal protein.
Got it. Okay. Anything else that comes to mind regarding supplementation?
I love L-Carnitine as well. L-Carnitine does many things. One, it can help with androgen receptor density, but it's basically like an extra fuel pump or shuttle for nutrients into your mitochondria. And if you take it orally, then you have to take a relatively high dose and potentially even watch TMAO, which it can convert to if you have a dysbiosis in your gut. And then pro and prebiotics will round out my list. I like to make the analogy of, your gut is kind of like a fish tank or an aquarium, and you have good fish, bad fish. You can feed the bad fish and good fish food. But if you just keep dumping in good fish and don't change the like fish food intake, and then you have postbiotics, kind of like tank cleaner, and then you drain your tank, hopefully once or twice a day, or maybe once every other day for some people is okay. But yeah, those are my top supplements.
I like that analogy. I've never
Thanks.
heard. So wait, so pro and prebiotics. Now, that's another market where there's a lot out there, and it's like, okay, what's junk, what's not, because it's not cheap, and supplementation can be expensive on a month-to-month basis. Is there certain pro and prebiotics that you're looking for?
Yeah, there's a lot of strains that I like. Good rule of thumb is lactobacillus and bifidobacterium are pretty good at acidification or crowding out other bacteria. Some people really like lactobacillus reuteri. It can be helpful for that. Akkermansia is also great at crowding out others. It's also associated with not having metabolic syndrome. Akkermansia happens to like having psyllium fiber. But there's a lot of other strains. For example, Saccharomyces boulardii is a yeast that helps crowd out C. diff. The clinical significance doesn't always match the studies. There's a lot that we don't know. There is pharmaceutical companies developing prescription-only probiotics, mostly for patients that have been hospitalized with C. diff before. What we do know is that strains that are high in lactobacillus and bifidobacterium genus strains are particularly good at preventing antibiotic-associated diarrhea, for example, from Augmentin. And you can even take those in between like antibiotic doses and then definitely afterward, and you'll have less symptoms. So that's kind of the number one use. But but I am extremely excited about that. There's many studies on pro and pre and postbiotics being done, but I do not have, there's like not one specific probiotic that's perfect for everyone. Everybody's aquarium or fish tank is very, very different. And one other note regarding microbiome testing, it's kind of like testing for cholesterol. If you test it 7 days in a row, you're going to have wildly different results, even with the same diet and stool habits. So take into account the number of stools. If you're not draining your stools, your microbiome report, whether it's a GI map or a Genova stool diagnostics, it could look higher if you have not drained it in a while. And that could be normal. Maybe you just need to drain more often. But another thing to take note is just expect a lot of variation from day to day. So it's important not to consume antibiotics or probiotics or change your diet or travel, if possible, for at least 2 to 4 weeks before a test like that.
Before like a gut microbiome test.
Yep.
Yeah.
And now we have oral microbiome tests. Now we have skin microbiome tests. In 5 years, a lot of this will be standard of care, hopefully, if things keep progressing in medicine and science.
Yeah. So as far as ways to improve gut health, one thing I will say I noticed for myself is when I was fasting a little bit more, I wasn't going as often. And now that I've implemented actually some fruit into the diet, I find that I am going more regular. Is that something that could be beneficial?
Yeah, that can absolutely be beneficial. With fiber, you think about your non-dietary and also your dietary fiber, both soluble and insoluble, and your prebiotic fiber. And you can't just consume one prebiotic fiber. Like you can't just consume inulin, which can cross-react with ragweed from time to time because they're both chicory family derived. But there's multiple types of prebiotic fiber that can help, like carbonoglycans. And then you also have resistant starch. So the world of like fruits and vegetables to help with bowel habits is pretty individualized. The best way to do this is just to try different ones and see how they help.
Okay. And is there a certain, I was just looking, I always see ads for them, a company called Seed. Are you familiar with them? What do you think about I'm looking at their daily symbiotic, which is like a pre and a probiotic.
Yep. Seed does have, I believe it's like a pomegranate capsule. They do have like both prebiotic fiber and probiotics in the capsule.
Right.
The thing that I don't like most about Seed is they make you sign up for a subscription, to my knowledge. You can't just like buy 120 capsules. Not everybody needs the same dose, and some people don't need to titrate up at all. So, and I don't think most individuals need to stay on Seed every day indefinitely. During certain times, I do personally take 1 Seed probiotic capsule per day.
Oh, okay. So you
I
sort
do
of
not titrate higher than that, even though I probably could, just because there is not a reason to titrate higher. Seed is one of the best ones. There's also spore-based probiotics like Megaspore, and there's also specialty probiotics like Saccharomyces boulardii or even Akkermansia. But my threshold for like starting a probiotic like that, especially without like a significant diet or lifestyle or prebiotic fiber change, is pretty low.
Yeah.
I do like Seed though. That was a long answer to say I like Seed.
Yeah, I see them all over the place, and they seem like they make a good product. But you were right; it is a subscription based model, which makes sense for them.
Yep.
But
not many things should be subscription based, but your healthcare with your doctor probably should be. The Cleveland Clinic charges up to $50 per message now. And most traditional doctors do not get paid anything for answering messages, even if it's helpful and like improves the time efficiency of both the patient and the provider. So that's another thing to think about.
Okay. Wow. And for the probiotic, for something like Seed, if you're taking that, you don't need to necessarily even take it every day, like you said.
Or you don't necessarily need to titrate up to multiple capsules per day.
Okay.
Yep.
I see. Wow. Lots of good stuff here. Coming up on the end, let's maybe give the audience. This is a question I like to ask my guests is what's one tip maybe to give in let's just say middle-aged individual that is looking to get their body back to what it once was back when they were in their 20s and 30s. What one tip would you give that individual?
Whether the effort is in optimizing your diet or finding a movement pastime to last a lifetime, your exercise regimen, find a way to make that effort feel good. Think about something that you do that you really enjoy that takes a lot of effort, whether it's a hobby or maybe it is exercise or whatnot, and find out how to apply that to optimizing that lifestyle pillar.
Love that. So like almost find something that takes like something that you maybe did back in your past and bring that back out sort of thing. Like, nice. Love that. Like rollerblading.
That could certainly be one. Rollerblading, rock climbing. There's all sorts of things. It doesn't necessarily have to be a movement pastime either,
okay.
but it could even be playing video games. So a lot of people can sit down and play video games for 10 hours in a row.
Oh
and
my
it's
God.
because it's interesting and there's a lot of nuance to understand. And there's definitely a reward with being good at something over time. But even for a video game, there's like the first time someone played and they're probably not very good.
Right. Or how about learning an instrument?
That's an excellent one.
Yeah. Well, this was great, Dr. Kyle. I appreciate you coming on. Where's the best place for people to learn about you and what you're doing?
My main base, I guess, is on Instagram, Kyle Gillett MD. Gillette is like the razor with the E shaved off, but you can find me all other platforms, Gillette Health. I also have a Gillette Health Clinic podcast. And then my website is gillettehealth.com. Spell it anyway.
Got it. And we'll put those in the show notes so people can find you. And you're in Kansas, so not too far from Chicago, like 8 hours, I think. Well, I appreciate you coming on, and thanks again for all the knowledge you dropped on us today.
Thank you. My pleasure.
Thanks for listening to the Get Lean, Eat Clean podcast. I understand there are millions of other podcasts out there, and you've chosen to listen to mine, and I appreciate that. Check out the show notes at briangrin.com for everything that was mentioned in this episode. Feel free to subscribe to the podcast and share it with a friend or family member that's looking to get their body back to what it once was. Thanks again, and have a great day.